technique requires pistoning, rotating, and fanning of the microresector for approximately 3 minutes. The disc is patient setting under local anesthesia and is typically completed within place a guide wire through Camon's triangle and into the center of the annula, and the construct is carefully placed over the guide wire into the annulus. The dilator and guide wire are removed after verifying correct placement. The microresector is inserted into the disc space through the cannula. The unique SpineJet microresector uses a high-velocity stream of sterile saline to quickly and safely resect and aspirate a small portion of the nucleus. Proper technique requires pistoning, rotating, and fanning of the microresector for approximately 3 minutes. The disc is decompressed, relieving nerve root impingement and pain. The hydrocision hydrodiscectomy procedure can be accomplished in an outpatient setting under local anesthesia and is typically completed within place a guide wire through Camon's triangle and into the center of the annula, and the construct is carefully placed over the guide wire into the annulus. The dilator and guide wire are removed after verifying correct placement. The microresector is inserted into the disc. Technique requires pistoning, rotating, and fanning of the microresector for accomplished in an outpatient setting under local anesthesia and is typically completed within place a guide wire through Camon's triangle and into the center of the annula, and the construct is carefully placed over the guide wire into the annulus. The dilator and guide wire are removed after verifying correct placement. The microresector is inserted into the disc space through the cannula. The unique SpineJet microresector uses a high-velocity stream of sterile saline to quickly and safely resect and aspirate a small portion of the nucleus. Proper technique requires pistoning, rotating, and fanning of the microresector for approximately 3 minutes. The disc is decompressed, relieving nerve root impingement and pain. The hydrocision hydrodiscectomy procedure can be accomplished in an outpatient setting under local anesthesia and is typically completed within place a guide wire through Camon's triangle and into the center of the annula, and the construct is carefully placed over the guide wire into the annulus. The dilator and guide wire are removed after verifying correct placement. The microresector is inserted into the disc space through the cannula. The unique SpineJet microresector uses a high-velocity stream of sterile saline to quickly and safely resect and aspirate a small
Hello, check, check. Hello, 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 check. Hello, 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 check.
Cost for our country. Please join us in this movement that we are calling Swasth Bharat. Thank you. Hello, doctor. Thank you for choosing to partner with us in restoring the health of our patients. I am very happy to be speaking to you today on a common priority for us, the well-being of our patients. Over the years, our journey has transformed from molecules to medicines and now to good health. India has about 70 million diabetic patients and the number is rising every day. Most of us recognize diet and exercise are an integral part of our diabetes therapy. A good proportion of doctors acknowledge
నువ్వు ఇంటికా ఉంటావు కాబట్టి తింటావు. చెక్. चेक. हेलो हेलो सादिक भाई. हेलो. Check. Check.
Good morning to one and all. I, Dr. Keertana DS, Senior Resident, Department of Anesthesiology, take the pleasure to welcome you all here for this 2-day CME workshop on interventional pain management. I invite Dr. H.L. Babirani Ma'am, Professor, Department of Anesthesiology, Gandhi Medical College, to deliver the welcome address.
We, on behalf of the prestigious Department of Anesthesia, Gandhi Medical College, extend a warm welcome to all the dignitaries, guests of honor, chief guests, and delegates and other faculty members to today's conference, which is on interventional pain management, which includes GME and workshop for 2 days. The multifaceted role of anesthesiologist is crucial in the armamentarium of healthcare. Pain is an unpleasant experience which we are, as anesthesiologists, are privileged to relieve it, thus adding a human touch. We have organized the CME program and the workshop as they are mandatory under the guidelines of the MCI so as to update our knowledge and skills. We now invite the organizing chairman, our dynamic HOD, Dr. Venkateshwarlu sir, on to the dais. He'll be expected very soon. I welcome our most respectable and esteemed chief guest, our DME Garu, Dr. K. Ramesh Reddy sir. Now that we are waiting for some of our guests, we'll go along with the program. We can start with our prayer song.
Shri Gananatham bhajare chittaparasatiyutam Shri Gananatham bhajare chittaparasatiyutam Shri Gananatham bhajare Nagayajñasutradharam Nadalayanandakaram Shri Gananatham bhajare chittaparasatiyutam Agamadisannutam Akhilalokapujitam Bhogisali bhavitam Yogisali sevitam Ragadveshatvirahitaramaniya hrudayamuditam Ragadveshatvirahitaramaniya hrudayamuditam Shri Guru Guha Sanmuditam Chinmula Kamalashritam Shri Gananatham bhajare chittaparasatiyutam Shri Gananatham bhajare.
I take the pleasure to invite Dr. Ram Pasupuleti sir, the course director of today's CME, an alumni of Gandhi Medical College, President, Kentucky Society of International Pain Specialists, and Director, Center of Pain Management, Kentucky, USA. Trained in interventional pain management, publications in national and international journals, practicing and teaching interventional pain management for 14 years now, and trained several pain physicians from all over the world. Organized and conducted and served as a faculty at several international pain management conferences and workshops in USA, India, Indonesia, and UAE. Welcome you, sir.
Morning, guys. Good morning. I expected a lot more people here today, but that's okay, I guess. Not very many people, but I think it's too early in the morning, I think. So I just wanted to get started on time. I want to keep on time. That's the point of the inauguration stuff is still to take place. The guests are not there yet. So I will start off with the introduction to the course. Always start with this Tyagaraya Kruti, Endaro Mahanubhavulu Andariki Vandanamulo. Telugu people, I'm sure know what it means, right? most of you, yeah? For those who are not Telugu challenged, several great people, I bow to each one of them. So this is one of my favorite kritis, and I don't have to explain that. So there are several great people, so I always, my respects to all of them. So this course is being conducted in collaboration with a few people here. As you can see, the Center for Pain Management, that's me. I'm the director for the Center for Pain Management, and Gandhi Medical College Alumni Association. We have a good association here, and they are helping me with this, and the Gandhi Hospital and Gandhi Medical College, and of course the Department of Anesthesia and Critical Care, which is the host for the meeting today. All of us came together to do this. So let's talk about the structure of the course. How is the structure? This is a 2-day course consisting of 1 day of didactic lectures today, and 1 day of cadaver and live demonstration teaching on 8th, tomorrow. Why are we doing this? Because interventional pain management is a rapidly growing field of medicine, particularly in India. It is important for clinicians in this field of medicine to know, understand, and evaluate available options to be able to continue to provide the best treatment options and quality of care for patients. The bottom line, we are all in here, is to provide quality care, right, to the patient. That's what we are here for. So to provide quality of care, we need to educate ourselves constantly, right? That's what it is. So, I always say I teach because I learn, and I learn because I teach. Just think about it for a second. Both are very profound statements. So I teach because I learn. Every time I teach, I learn. And every time I learn, I teach. And all of us, as physicians, we are bound by our oath to teach, right? As a physician, we are supposed to be teaching all our lives. And all in the interest of the providing quality of care for patients. So who's the audience for this? The course is meant for graduate and postgraduate students, faculty and physicians from anesthesia and related fields of medicine who are interested in the subspecialty of pain management. Good example, we have a neurosurgeon here. Of course, he is interested in pain management. That's why he's here. Thank you for coming, Dr. Prakash Ragaru. Thanks. And we have an orthopedic surgeon, and we'll have other people as well. So this is not meant only for anesthesiologists, but any related fields who are interested in pain management. And I'm doing this mainly for postgraduates. Guys, this is for you. This is for you. Because this, my intention in this is to give you some kind of a look into pain management. And as anesthesia postgraduates, you should know what pain management is, and that's the point of this course. Morning, Dr. Joshi. What are the objectives for this course? We will review and discuss basic concepts in pain management, and we'll also demonstrate basic interventional procedures and cadavers, and under fluoroscopic guidance, and also on live volunteers under ultrasound guidance and video demonstration. So we're going to have all this. We're going to talk about it a little later, but this is one of the objectives of the course. Another objective is to enable participants to learn basic concepts, procedures, and skills in interventional pain management with hands-on experience. And of course, everybody is asking for CME. Of course, do we have CME? Yes, we do. The Telangana State Medical Council has awarded accreditation of 2 credits on February 7th and 2 on February 8th for delegates attending the course. So you will get a total of 4 hours if you attend the full 2 days. Who are the faculty? That's me on the left, and the other picture you see is Dr. Sridevi. We are the course directors, and the organizing chairman is Dr. Venkateshwarlu. Is he here? Okay. Dr. Venkateshwarlu is the professor and head of the Department of Anesthesia. About myself, I'm the director for the Center for Pain Management and the president of the Kentucky Society of Interventional Pain Physicians. I practice in Bowling Green, Kentucky. My fellowship training in pain management is from Texas Tech University, Lubbock, Texas. I don't know if you've heard the names of Dr. Prithvi Raj. Anybody heard the name of Prithvi Raj in pain management? One of the biggest names in pain management. He's about 10 textbooks in pain management. and Dr. Rax, I trained under both of them. So they are very world-renowned pain physicians. And my graduate training is from Gandhi Medical College. These are hallowed grounds for me. This is where I come from. My training is from here, Gandhi Medical College. And I'm proud of it. And that is the reason why I'm back here trying to... and let me tell you this, you know, Indian medical graduates and Indian physicians are not among the best, but they are the best in the United States. There was a study recently, I'm sure you, yeah, and there was a study recently, this was a Harvard study, they showed that the morbidity, mortality was much less in US patients treated by Indian physicians. That's how good we are. So, and the training we get is from these medical colleges. So, you better respect your medical schools and medical colleges. And that is the reason why I'm back here, trying to give back to my medical school. I have 15 years of experience in the field of pain management as an interventional pain management physician. I'm the faculty for American Society of Interventional Pain Physicians. I teach and train pain physicians from all over the world. Physicians come from different countries, Indonesia, Africa, to my center to train. I have physicians from India come and train with me. I have 2 students who are faculty today who came and trained with me as well. I have conducted several pain management workshops, and I've authored a couple of chapters in textbooks. One of it is Dr. Joshi's textbook of pain management. We'll talk about that here in a second. And I'm the co-author of the ACIP guidelines for safe opioid prescribing. And I've been teaching pain management in India since 2003. I think that was the first time I met you, Murli, right? 2003? You were in Apollo. Yeah. So I conducted the first cadaver course in pain management in India in 2006 in Delhi. That was at the All India Institute of Medical Sciences. And we did the first spinal cord stimulator trial for pain in India as well. And then I teach several workshops all over India every year. We just finished teaching at Delhi. This was the Indian Society for Study of Pain. Both me and Dr. Joshi were teaching there. We just got back. Did you get back today? Or yes? Okay. My mission in India, what have I been doing? I created awareness to sustain, maintain, and expand the field of pain management, brought the latest advances in pain management to India, trained several physicians from India at my center, trained most of the currently practicing pain physicians in India, and I've collaborated with the most prominent pain physicians in India. A good example is Dr. Joshi. I've been working with him for over 14 or 15 years. We have been working together. And I've assisted in establishing several pain clinics in India, Delhi, Kolkata, Jaipur, Chennai. Let's talk about the other faculty. Enough about me. You see, this is Dr. Joshi, the superstar of pain management in India. So, समझो अमिताभ बच्चन है pain management के. So he's a very well-known name in pain management, and more than the name, I think, you know, he's an educator. That's why I like him. He has been teaching pain management longer than me, and he's got a lot of fuss there. He's the first to start fellowship in pain management in India. Give him a hand for that. He's the first to write a textbook of pain management in India. Also another hand for him, please. I see we have guests coming in. And he's also the first to start e-learning in pain management in India. And like I said, you know, he's got his resume goes out of the slide. But suffice it to say, he's an excellent educator. And if you guys want to learn anything about pain management here, I would direct you to Dr. Joshi. And in the textbook that he edited, produced, I contributed a chapter to that as well. The other faculty here is Dr. Sridevi. I don't think she's here, right? She's not here yet. I hope she gets here. It's 9 o'clock, so I hope she gets here. She's a consultant in the interventional pain physician at the Kamineni Hospital. I think this was after you left, Murli, right? Kamineni, or yeah. So, did you train her as well? Yeah. Well, I trained her. She came to the United States to train with me. She's got fellowship in interventional pain management from the World Institute of Pain. So and she also has a fellowship in palliative care and pain management. The point I'm trying to make is the faculty you have is excellent. That is the point I'm trying to make. So not to tout about their accomplishments, but the point is that you have excellent faculty today. Dr. Joshi, another Joshi, Dr. Sachin Joshi. Murli, is he here? Okay, okay. So he works with Dr. Muralidhar Joshi, and I think he trained under Dr. Joshi in pain management, and he has a book chapter, Pain in HIV Patients, so he's very interested in pain management, and he's an excellent, I hear he's a good ultrasound guy, so he'll be teaching us ultrasound. Dr. Anand Murugesan, he's Apollo Chennai. He's the consultant in the anesthesiology and interventional pain management. More importantly, he trained with me. That's why I can trust him. So I trained him in United States, and he went to Canada also to get observership in pain management. He'll be landing shortly. In fact, I think he's landing in, he's almost here. So he's on his way. So he's coming from Chennai, so he'll be here. And we have Dr. Sridevi, Associate Professor, Department of Anesthesiology, Gandhi Medical College. She's very, very, very interested in pain management. And I can tell you, she's the one person who single-handedly made this happen. So give her a big hand, please. Almost single-handedly. It would not have been possible without Dr. Sridevi. So give her a big hand. And she's running the pain clinic here, and that's the point of this conference, is to get the pain clinic running and going. And she's doing part-time now, but I'm hoping it'll be full-time soon, right? So that's the point. And we have Dr. Kolipara here. He's sitting here. He's been in private practice in anesthesia and pain in the USA for a very long time, and he's also from Gandhi, so Gandhi Medical College, and he also happens to be my cousin. So that's not a qualification, but still, you know. Yeah. He's very well trained, and I think he worked with Dr. Winnie, right? Alan Winnie and yeah, Frank Moya, very big names in pain management when he was training. He's also very well versed with pain management, and he's retired, and he's here in India now, helping with a lot of stuff with the Alumni Center. I'm not going to go through every single, you have the brochure, you know what the schedule looks like. The point I'm trying to make in this slide is that I've organized this conference into very basic pain management conference. We talk about very basic concepts. A good example, if we start off with pain management past, present, and future, which is the next talk. We'll talk about what pain management is to begin with, and then we go on to neck pain, the pathophysiology, diagnosis, and management, which will be done by Dr. Joshi. And then we go on to low back pain, which are the most important topics in pain management, right? Neck pain, low back pain. That's what you're going to see. Come on in, Sridevi. Good morning. Hey, that's my classmate, another Sridevi. So, come on, Anand. Come on, come on. We're waiting for you. Come on, come on. Join us. Join us. And then we go on to imaging in chronic back pain. And then we go to basic principles and practice of ultrasound in pain management. Then we go to fluoroscopy and needle manipulation in pain management. So the very, very basic topics here. And then we Dr. Sridevi will talk about complex regional pain syndrome. And finally, cancer pain, which is another important part of pain. Dr. Joshi will handle that topic. And I'll do the basic interventions in low back pain, how to do epidural steroid injections and medial branch blocks and so on and so forth. Tomorrow, the most important part of the program is the cadaver and live workshop. That will be tomorrow. And let me tell you the structure of the cadaver workshop. We have divided this into 5 stations, as you can see. 2 cadaver stations, 1 ultrasound station, 1 video demonstration station, and 1 equipment demonstration station. So you will be divided into groups. We'll talk about that a little later, but basically this is what the content of it is. These are the groups. Everybody will get a schedule, and each of you have a badge. And if you look behind the badge, you have your group number and stuff like that. We'll talk about the structure of this program a little later today or tomorrow. I'll explain to you how things will go tomorrow. Certain rules and regulations, guys. Time is of the essence. Stay on time. So that's why we are trying to do this. Though we don't have the guests, we started off because I wanted to stay on time. So all of you, I want you, and more importantly, faculty as well, I want you to stick to your time. That way we can keep moving. Save all questions until the end of the presentation to allow us to stay on schedule. Faculty will be available throughout the length of the course to answer questions. So kindly turn your cell phones off, be courteous, or put them on vibrate. If you have to take a call, please step outside. No social media, texting, messaging, accessing, please refrain from doing this. You have to sign in at the registration, guys, to get your CME credits. And you will get your certificate tomorrow at tea break. Check the schedule of the workshop and make sure what group you're in for the workshop so that there's no confusion. Every one of you has to know at any given time tomorrow which group you are and what station you're on. Follow your rotations. Do not jump from one group to the other, okay? Please be courteous to your other participants. And be aware of the time limits on the cadaver stations. Very, very limited time. We had to close down registrations because we had so many registrations. So we don't have that many faculty or the resources to do it. So we had to close down registrations, and hopefully each of you will get some hands-on time on the cadaver. We'll talk about it again a little later. Finally, acknowledgements. I have to thank a lot of people here. I'll put all of them here, and I'll go one by one. Dr. Sridevi, of course, is the main person here. Let's all give her one more big hand, please. And Dr. Venkateshwar Garu, he has been instrumental. If Dr. Sridevi was doing it, Dr. Venkateshwar Garu, he let her do it. That's the point. He's the head of the Department of Anesthesia. So please give him a big hand. And I want to thank all the postgraduate students and graduate students of the Department of Anesthesia. They've been working hard to put this together. Give yourselves a big hand, guys. And all the event coordinators and members of various committees. And I want to specially thank the superintendent of the Gandhi Hospital. He's not here, but I want to specially thank him. He went out of his way to do this, to give us the cadavers, to give us the department, to give us everything. He did all that. And the principal also. I guess they'll be here shortly. I want to thank them. And the forensic department, where we are standing now, we have to thank them because of them we are doing it here. The neurosurgery department, the head of the department is right here. Thank you, sir. Thank you for your support, and thanks a lot. Give him a big hand, please. And I want to thank General Surgery Department. Venkat is not here. Venkat is my classmate, and he also has helped me do this. And thank you guys for helping us with this, and the caterers. And I want to thank the Gandhi Medical College Alumni Association, and the faculty, attendees, classmates, friends, family, and whoever else you can think of. I guess I need to add God there, so thanks. I forgot to add God. Well, anyway, thank you. So that's the introduction to the course. Thanks, guys. I think the next, we are waiting for the guests to come in, and as they come in, the inauguration will happen, and then we'll go straight to the rest of the topics.
బ్యాగ్లో ఇట్లా పెట్టారా?
I just want to orient you guys to the workshop tomorrow, right? So how many registrants for the workshop? Raise your hands. Okay. Once again, the point is we have 5 stations. Each station is 1 hour 45 minutes, okay? And there are 2 cadaver stations where you learn fluoroscopic guided procedures, and 1 ultrasound station where demonstration will be done on live people and you will not do any procedures, right? Because they're people, they're live people, so you're not going to do any procedures. They won't like that. So, 1 video demonstration station and one equipment demonstration station. So we'll demonstrate equipment we use in pain management, like radio frequency machines, ultrasound machines, and so on and so forth. And in the video demonstration, you will learn how to do procedures. You will learn epidural steroid injection. You'll learn facet blocks. You'll learn radio frequency. You learn spinal cord stimulation. All of them will be on the videos as well. Let's go through the stations here. Station 1, 1 hour 45 minutes, hands-on, cervical epidural steroid injection and intercostal nerve block. So you're going to learn these two procedures on the cadaver. Station 2, hands-on, lumbar epidural steroid injection and lumbar medial branch block. So you'll learn these two procedures in Station 2. And there will be one demonstration of a caudal epidural steroid injection. The instructor, the faculty will demonstrate this, but you will not do it on the, you will not do it, but you'll see it. Station 3, 1 hour 45 minutes, ultrasound demonstration. You'll learn stellate ganglion block, shoulder joint injection, suprascapular nerve block, caudal epidural steroid injection, piriformis injection, and knee joint injection. This is what you're going to learn in the ultrasound demonstration station. That is Station 3. Station 4, video demonstration station. You'll have videos on procedure room setup, how to set up a pain management procedure room. If you guys want to go out and start a pain management practice, what would you do? How do you set up a procedure room? You can watch that. Radiation safety, because we use a C-arm. We have to have radiation safety. Lumbar epidural steroid injection, how to do it. Radio frequency thermocoagulation, how to do the radio frequency. Spinal cord stimulation, what is spinal cord stimulation? How to do it. How to do a trial, how to do a permanent implant. You will watch all that. Station 5, 1 hour 45 minutes. Equipment demonstration station, we'll demonstrate radio frequency thermocoagulation machines, ultrasound machine, spinal cord stimulator batteries and leads, needles, all the needles that we use in pain management, catheters, probes, so on and so forth. So the basic equipment that a pain management physician uses on an everyday basis is what you're going to see there. Your guys are divided into 5 groups. A, B, C, D, and E. Each group has about 11 participants. Each group is allotted 1 station at a time. Example, Group A will be at Station 1 from 8:30 to 10:15. Okay, guys, one of you, stand up. Yeah. Can you tell me what station you're in tomorrow? Station A. You have the timings, right? So everyone's got the same badge. You have the stations on your badges. So there should be no confusion. And you know the timings, right? You know the timings where you are. So everyone should know their timings where they are. At the end of one time slot, each group will move to their next designated station. The back of each participant's name badge has their group station and time designation. Schedule will also be posted on the wall of the workshop area. And participants and faculty are expected to be at their respective stations and get started by 8:30. Okay? The breakfast is not from 8 to 9 tomorrow, it's from 8 to 8:30. You're going to start at your station at 8:30. If you're late, guess what? You're the one who's going to miss the hands-on time. So be on time. This is the schedule. Look at this. And it will be posted on the walls there, and the faculty will be given a separate schedule. Murli, I'll give you a separate schedule. Dr. Sridevi and Anand, I'll give you a separate schedule for you. Rules of order, the same thing. No cell phones, please. If you have to take a call, step outside. No texting, messaging. I know it's very important these days. You know, you're all messaging. I'm in the meeting now. So Facebook update. Yeah, I guess nobody else needs to know about that. So if you want to, I guess you can do it, but not here. So follow your rotations, please. Stay in your group. Do not jump from one group to the other. Be aware of the time limits at the cadaver stations. Each participant is allowed no more than 8 minutes on the cadaver station, and we will herd you out. We will, you know, push you out as it happens, because the other people have to do it. Each group will move to their next designated station precisely after the allotted time. Remember the fact that you get to watch the procedure while the other 10 participants are doing it. That is more important, guys, than you yourself doing it, because you get to watch it 10 times. So just consider that. And that's more important than anything else. So if you get to watch it, the more number of times you watch it, then it gets easier for you. Hey, Kavita, how are you? Come on, join us in the front here. She's my classmate, so. Have a seat there. And guys, please wear radiation shields on the fluoroscope. We are going to talk about radiation safety tomorrow. Actually, no, today. We're going to talk about it, and it's very, very important for you to wear the shields and aprons at the fluoroscope stations. Please be considerate to your fellow participants and give them a chance. Don't hog the time. So please be considerate. Any questions, guys, so far? I don't have to go through all this again, but any questions about the workshop tomorrow? No? I guess we are still in suspended animation mode here, waiting for the guests. So. I think we have important guests coming in today. I think the Director of Medical Education is coming in, so that's the reason why we're waiting. So, the principal's here, I think. Morning, ma'am. Burgess, come on. Join us. I have my Little Flower High School classmates here, so that's good. Good stuff. Gandhi Medical College classmates and Little Flower High School classmates. So